Is Carla Caldwell. I am a nurse, innovator, and master coach who helps healthcare leaders heal themselves and redesign the systems around them, creating a ripple effect that transforms teams, patients, and communities. And today I'm super excited because I'm going to be talking about a communication skill that changes everything. From motivational interviewing, the use of summaries is extremely powerful. And I'm going to talk about what summaries are, how they're structured, and four different parts of the communication exchange where you can use summaries to help improve outcomes. This talk is tailored for healthcare leaders, people working in the helping industry, but, or I should say, and summaries can be used at home, they can be used in business. So feel free to take the examples and just tailor them to your unique situation. Okay, so summaries. From today's lens, the definition of summaries, it's a form of reflective listening. They help to group relevant is key here, relevant statements into one summary to support communication focused on taking positive actions for health and well-being. The structure of a summary, it's always the same. Even though you may be using the summary for different reasons, the structure's always the same. You start with indicating you're about to summarize. You share a series of relevant, concise reflections and affirmations. I cannot emphasize relevant enough because when you are working with someone in a healthcare setting, actually, in most any setting, sometimes there's a lot of information that's not relevant to the subject at hand. So when you're summarizing, you're being very strategic. You are focusing on what is relevant and you're sharing it back in a concise way, reflecting. Number 3, it usually ends with an open-ended question to facilitate progression of the conversation. And I'm going to give lots of different examples of what that would look like, depending where in the conversation you're using summaries. So, the first place to use summaries is in the beginning of a conversation. And when you use it in the beginning, you are using summaries to build trust. So, often in the beginning of a communication exchange, in this situation, we're going to look at a healthcare setting, a visit. So, in the beginning of a visit, you will ask an open ended question that is focused. So I want to recommend staying away from really generic questions like, how are things going? Or what is new? How's your day? Those are penny questions that yield penny type results. And because your time is valuable and your patient and client's time is extremely valuable, we want to be strategic about how we ask our questions. So we're going to start with an open-ended question that is focused. For example, you may choose to ask a question like, what matters most to you in regards to your health? Or you may ask, what concerns you the most regarding your health? Another great question, what would you like to accomplish today during our time together? Those questions are focused, they're open-ended, which will give your client or patient the opportunity to give an answer that matters, that is relevant to them, and it's also focused and strategic. So, when you ask this focused, open ended question, this is the first opportunity to summarize. And we're using this summary to build trust. So, in this situation, um, let's say we're talking to a Mr. Smith and they've just shared a lot of different information. Some of it's relevant to their health and some of it isn't. I'm going to focus on what is relevant. So the summary might look something like this: Mr. Smith, let me see if I understand your concerns. You want to learn more about foods that can help you lower your blood pressure. You've been experiencing more headaches than usual, and your prescription for cholesterol needs refills. Anything else I may have missed? So, when you're summarizing, notice that I focused on all health related items. Maybe Mr. Smith shared about their neighbors, about some of their latest stressors, about not finding parking, and I focused on what was relevant. So that's the first kind of summary. It's to build trust, and we are starting with a focused, open ended, relevant question. Number two way to use summaries: redirection. Oh my goodness. In healthcare, this happens a lot where our client might be talking about lots of different things and they might be going off on a tangent. And I don't want to interrupt, but I also know their time is valuable, my time is valuable, and it's a time sensitive situation. So I can use summaries as a redirection tool that is polite and it helps us get back on track. So, what you're going to do in this situation is you're going to use the structure. Remember, the structures indicate you're about to summarize. So, in this situation, you're going to say, I'm sorry to interrupt. Your time is valuable, and I want to make sure we take care of you today in the best way possible. And remember, in the structure, you're going to share relevant, concise reflections and end with a question, a focused, open ended question. So, as you're redirecting, you're announcing that you're going to be summarizing. You're going to share some um, relevant reflections, because the whole reason you're redirecting is there's been a lot of information that is not really going, it's not moving your client or patient forward. And so you really want to focus on anything they may have said that relates to the visit. Okay. And then you'll end with an open ended question. So I'm going to give you an example. I'm going to name this client Miss Garcia, and she's sharing a lot of different information. She's talking about why her blood pressure keeps going up, and some of what she's sharing is relevant, and some of it includes sharing about different stressors outside of her control. And so some random stories are thrown in, and you want to focus on what's within her control. So, what you might say is, Ms. Garcia, your time is important. I want to make sure we come up with a plan for lowering your blood pressure. Let me see if I understand. Your blood pressure increases when you're stressed. You have found that when you go walking with your daughter, it helps. You heard from your neighbor that yoga and meditation can help. And lastly, you'd really like to find some ways to lower your blood pressure without before having to use medication. Is it okay if I share with you some of the classes and resources we have that can help you to lower your blood pressure? and lower your stress. And if I get a yes, then now we're focused, right? I can share some relevant information and we can keep moving forward. I love this one so much because in our healthcare helping situations, time is very limited. So it's really important that we be efficient. And this is a skill that supports you to be efficient and keep your client or patient moving forward towards relevant actions they can take. All right, third. I said I love all of these. I love number 3 probably the best. And this is using summaries to support your patient or client to take action towards positive health behavior change. So, this is really helpful if your client or patient is making statements indicating why they need to change, want to change, why they might be able to change. When someone is sharing reasons why they want to change and why it's necessary, why they are able, and why they need to, this is a perfect time to use summaries to transition between the idea of change to identifying potential actions they can take. So if you hear your client or patient talking about why they might want to change, why they need to change, don't forget your summaries tool. Don't forget this skill. It's so helpful in this situation. Structure's the same. You're going to announce that you are going to summarize. You're going to summarize relevant statements that your patient or client may have shared, and you're going to end with an open ended question to move forward. So, what this might look like is, let's say that your client is named Mr. De Leon. So you might say, Mr. De Leon, you mentioned you wanted to quit smoking because you're concerned for your future health. You stated that you have tried in the past and found patches to be helpful, along with breathing. You said that breathing was very helpful during those times that you attempted to quit. You also shared that you're motivated to quit because you want to be present in your granddaughter's life. It sounds like you have some really important reasons to change and you have experience quitting in the past. What would you like to do next? Another question you could use there is, what is your next best step? Or how can I support you in your tobacco cessation goal? So, in this, when you're using summarizing in this way, you're really helping someone move from the idea of needing to change, to the actual action. Because you're going to move from this, your patient client just named all these reasons why they want to change, why they can change. And now you're helping them get into action territory where they might set a goal or you might connect them to a service. It's an excellent use of summaries. Okay, last use of summary is towards the end of a visit. And this is a time where you are supporting your patient or client to plan, to start planning. What are they going to do when they leave this visit? You can use a summary during this stage to reflect what has happened during the visit, and the structure is the same. You're going to announce that you're summarizing. You're going to summarize everything that happened during the visit that's relevant. And then you're going to ask an open ended question. What I recommend for this question is asking the patient client, what is their understanding of what they will do next? Very helpful question. This will help you to see what your patient understood from the visit, what they're going to do next, and it provides you an opportunity to share relevant education or fill in any gaps of misunderstanding your patient may have. It's an excellent, excellent use of a summary. To recap, summaries are really, really powerful skill. And the more you practice, the better you'll get at this. I want to encourage you to use summary during 4 different parts of a communication exchange. They can be used in the beginning to build trust. They can be used for redirection. If your patient or client is starting to go off on a tangent, it's a polite way to redirect and ground your patient and or client to back to the subject at hand, back to improving their health. 3, it can help you move from change talk to taking action. So, supporting your patient client to move from talking about making a positive change to actually creating an action step. And lastly, at the end of a communication exchange, to summarize what has happened during your visit and to ask your patient, what is your understanding of what happened during the visit and your next steps? I really hope this was helpful. Let me know in the comments if you are going to practice summaries and let me know which one. I am rooting for your success. Please share this recording with anyone who may benefit. I hope you have a great day. Bye. Thank you.